this video, I want to talk about how to release all of your excess lymph through here. If you want to look nice and svelte, stay tuned. It's coming up. Hi, Christine Byer here, licensed esthetician for 20 years. I have basically a clean face. I have some tinted moisturizer on, a little bit of concealer, but you'll want to do this on a clean face. And you can do this quickly in the shower. You can do this quickly before you do any of your devices at night. You can do this anytime, and it's a quick standalone treatment. And lymph nodes in the face tend to be here. And then 90% of the lymph nodes of the entire head and neck unit are right here. And so this is where I collect, and this is where a lot of my clients collect here. And when I'm done with lymph drainage, a lot of them will say, it looks like my face lost weight, but in a good way. So I will start just releasing this big ropey sternocleidomastoid, which people, if you turn your head, you'll see it poke out. It is contracted on 99.99% of my clients. And this is just, this is technique. This is just from looking down at devices and looking down at computers. And so if these two big ropey muscles, if these muscles are contracted, you will get lymph traffic jam, especially if you are sedentary. I would say it happens to all of us, but as we get older, it's worse and worse, as with anything, right? So just gonna do this, and you're just using, if you have fingernails, you're gonna have to turn your fingers to the side and grab the side, and we're just gonna give it some room, and we're just sort of squeezing it, pinching it, right? We're giving it fresh blood supply, or oxygenating those muscles, but we're just walking up and down those big ropey muscles, just walking up and down, and it could be tender. So that's normal. Don't go crazy with this. Give it a good three minutes or so. And then we're going to work on the jaw. So the jaw, I would just quickly do this. You can come up here and pinch right here. I would move on to underneath the cheeks and just do a quickie like this. These are actually not lymph drainage moves, but they are fascia release moves, but they also release lymph when you do them. I would do this. And I look like I've got a lot stuck in here, so I'm going to go ahead and release the eye. So you always want to anchor. This is kind of like lymph drainage plus. Anchor, follow that bone. It's kind of like a 4 sides release. So it's anchor, strip the eyebrow, anchor. This one actually you're pulling apart. Anchor, and then here I'll do that one more time. I'll go around it, the eyebrow, the eye, one more time, just so you can see what I'm doing. 2 fingers, one on each side of the tear duct, and gently pulling apart. This feels great if you wear glasses. Anchor, writing this bone. All right, so I'll do that. What else will I do? Just release the upper brow. Release the top of the head where you're just digging in, and you're going to go in a circle, and then you'll go the other way, and then you'll start on the other side. Well, this is a quickie. I have whole videos on how to release the jaw on the inside and the outside of the mouth. This is really just a quickie jaw release. What else did we do? We released the deep fascia underneath the cheek. If you have heavy cheeks, you'll want to do this 5 to 7 times, 7 to 10 times. We'll do a quick eye release. Remember, anchor, and strip. And then one finger below, one finger above the tear trough. Slide. Do this gently. I have enough slip and glide on my face from layers and layers of everything I put on it before I put my moisturizer. So my face is very slippery. But you could do this in the shower with the water from the shower. You can do this with a light massage oil. Something like jojoba oil would be nice, or grapeseed oil if you're really dry would be nice. And let's see, we did this. Now we're going to anchor and slide along the bone. You will feel the orbital bone. And then just release here. And I'll do that again so you can see it. This is going to really depuff the eyes. Anchor, slide. Anchor, slide. Well, this is more of a sliding movement. All right, and then just for good measure, let's release that forehead again. This is the belly of the muscle of the forehead, believe it or not. So if you have a lot of forehead tension and you go in here and release, this is all I'm doing. It's just trying to get some movement into the scalp. If you have sinus problems, that could be tender. All right, so now we're gonna go in and we're gonna start doing our scooping movements. And I basically just make a fist, kind of an open fist, and I scoop, 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 and I scoop. And that's all I'm basically doing as I'm starting at the jaw and I'm sliding along the jaw. I'll have my thumb underneath it. So it's scoop, 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 scoop. And remember, lymph is very superficial, and after we do those quick moves, we are releasing a lot of trapped lymph from like looking at the phone a lot or computer screen. Every time you laugh and smile, you're tensing this whole complex, so we released that quickly. There are more muscles you can release around your mouth for a nice payoff, but this video is focused mainly on lymph drainage. So now we've released that, and that we'll start to release deep trapped lymph. So what we do now is we scoop, and so go back. And this is just something you would want to do maybe 5 to 7 times. And it's not hard. It's just a quickie, and then we're going down and scoop out. And so when I'm working on clients, I will push my palms in, but that's kind of hard to do to yourself. I guess, nah. Whatever you do that forms sort of a plane. I like this scooping movement because you feel like you're scooping out that lymph that we released. We loosened everything up and we're scooping. And then we're pushing it down, out, down, out. Lymph nodes here, lymph nodes here. The main portal that the lymph nodes drain into is at the collarbone, so we want to push everything down and flush it out. So once you get there, I'll do this to my clients, and it's kind of just a quickie. I'm just sort of, and I'm not pulling, I'm just sliding down the skin and flushing. It's a slide and a flush, a slide and a flush, a slide and a flush. So that is in a nutshell how you would do lymph drainage. Let's take a look. Yeah, this looks better. Another thing you can do with your neck is and this is if you don't have any neck issues, only do this if your neck is 100% healthy, but there are different, side to side, and then stretching exercises that will help. And if we're not, the more we move our neck around, the more that this lymph that gets trapped here can escape, and the more stretch we get to sternocleidomastoid and all our neck muscles. This is always a good thing to do. Mine is tight. Okay, so I hope that helps. Sometimes I feel like I throw so much information out that it's a little overwhelming, but just know you can replay this video until you get it. Just follow that lymph drainage pattern. Pretty hard to get this wrong. The body really knows what to do. It's just that helping it along as we get older is always a good idea, because the less we move, the less the lymph moves, because the lymph system does not have a heart to push it through. And so it essentially moves only when we move. And if we're not moving enough, and if things are really tight and restricted, that flow is not happening. So we just do this to move it along. All right, thanks for watching. See you now. Bye.